So if you're missing only like 1 or 2 teeth in the back, because you say it's very common that that's where you lose your teeth first.
Yeah.
If you can't see them,
Yeah.
and it's only 1 or 2 in the back, you say you need to replace those.
Yes.
Tell me about that.
You know, that's a great question because I hear that every day. You know,
Really?
of course, the patients think the same way you do, right? Why do I have to replace them? Well, the first thing, and those are your main chewing teeth. So if you're not going to be chewing where you lost that tooth, you're going to chew on the other side of your mouth all the time. What happens? Your muscles get bigger. Your face now looks lopsided. Okay? If you're missing more teeth in the back where you're only using your front teeth to chew, obviously those teeth are going to break down. But even worse than that, in the back, your jaw starts to collapse. When you
look older.
You look older, you get lines in your face. You can see people who don't have teeth. They have those lines in their lips. And when you replace your teeth, all of that goes away and you now look younger again.